with a unilateral congenital ptosis and a fair LPS action. Now this patient is taken up for LPS resection surgery, but what we are doing here is more of tightening the LPS instead of resecting it. So we start off with a skin incision, which I usually give with my monopolar cautery. After the incision, you start dissecting the orbicularis. The orbicularis is dissected perpendicularly to the skin incision so as to reach the white structure beneath it, which is the tarsus. So when you visualize the tarsus, you change the direction of dissection inferiorly and start separating orbicularis from the tarsus plate so as to create enough space for your anchoring sutures. Now once you have exposed the anterior surface of the tarsus, you move your dissection superiorly and start dissecting the levator muscle. There are multiple ways to do this. I like to dissect the posterior surface of the LPS first and then the anterior surface. In this step, you separate the LPS gently from the underlying molars muscle. And once you have adequate exposure of the posterior surface, you pull down the LPS muscle and then start exposing the anterior surface. The landmark of your dissection of the anterior surface are the pad pads. So once you see the pad pads, you gently separate them with a Q-tip and make sure not to go too superiorly, too high to avoid damage to the Wittnau's ligament. Now for suturing this muscle to the tarsus plate, a 6-foot Prolian suture is passed from the aponeurosis and then through the tarsus and then back from the LPS aponeurosis. At this point, I like to check my final correction by putting a slip knot and assessing the eyelid height. Once I am satisfied with the final eyelid height, I move on to put 2 additional sutures, one medially and one laterally for the eyelid contour. These are passed in the same manner as the central anchoring suture. And before tying all the sutures, slip knot is passed again to make sure you do not have any eyelid notch or an abnormal contour of the eyelid. skin crease forming suture is then formed by taking the levator muscle from the closure bites in interrupted manner. So you can use 3 or 4 of these sutures to form the upper eyelid crease. And Then the skin is closed with either 6 so prolene interrupted or continuous sutures.